Parents are today sounding the alarm after a spate of deaths linked to a commonly used asthma drug. And while the risks are low, the potential consequences are frightening.
My son his name's Patrick. He was on Singulair from 9 years old to about 11 years old. And he suffered severe side effects that tore our family apart, basically.
11 years ago, Jocelyn Suter's son Patrick was prescribed Singulair.
His allergy specialist didn't warn him or us that there was any side effects. We had the prescription refilled by 2 different doctors. They didn't warn us about any side effects.
For 2 years, she watched her son slip further away.
He was at a school camp and he was showing severe distress.
Attributing his growing anxiety to allergies.
He had severe insomnia. He would come into our room every night crying, saying that he couldn't go to sleep. He had severe anxiety. He didn't want to go to school. He would lie in bed when I was trying to get him to go to sleep and he would say, you know, you would all be better off if I weren't here.
But when Jocelyn Googled the side effects of his asthma medication, she was shocked.
Suddenly, all these other parents' stories came up that were exactly similar to my son's.
Singulair and Montelukast are used to treat chronic asthma and allergies. And while they're effective and safe for most of the 27,000 Australian patients currently on the drugs, the active ingredient, though, is linked to neuropsychiatric events, including nightmares, hallucinations and suicidal thoughts in 313 local cases, as well as 4 deaths. Children as young as 2 can be prescribed the chewable tablets, which have been on the Aussie market since 1997.
This medication, Montelukast, is really quite effective in certain people with asthma and it's reasonably safe. It's also in a tablet form compared to most of the asthma drugs which are used as inhalers.
But the side effects can be extreme.
These are very rare, less than 0.1% of the population, and they may range, across a spectrum from milder issues such as insomnia, sleep disturbances, nightmares, to some, changes in mood, low mood, irritability, and very, very rarely they might also be suicidal thinking.
In 2018, the TGA decided information about the drug's side effects should be included in boxes. Now, advocates are calling on Australia to do more and follow the US and UK lead with bold warnings parents can't miss.
We would ask the TGA, please, don't treat Australians differently. Please put a box warning on Montelukast as well.
Well, if you find yourself in need of help for any reason, crisis support is always available 24/7. Through Lifeline on 13 11 14. There's also the Kids Helpline. That's on 1800 55 1800.
Well, 4 years ago, Celeste Booth's then 3-year-old daughter, Eleanor, had minor asthma symptoms when they saw a new GP. Celeste joins us now. Did the doctor tell you anything about the side effects?
From memory, there was a leaflet with side effects at that time. I've noticed since most medications you get now don't have that leaflet that they used to have, but this was a fair few years ago and that was with the box, and the doctor, he warned that there could be some effects like mood changes and aggression and that sort of thing, and just to keep an eye out for it, and if we had any concerns to come back to him and see him about it.
And how rapidly did you see a change in your child, and how significant were the changes?
It was gradual. We didn't notice anything. I think it was about a month and a half. I just noticed Eleanor didn't have her play voice. It's sort of like when she's playing dolls and they talk in their little voice and sort of a high-pitched play voice, and that was missing. I'd noticed, I didn't know if it'd been a week or 2 weeks, but I just sort of noticed that it was gone, it wasn't there, and this is something that she did every day. Everything she did, she has a good imagination and loves to play, and I just noticed that was missing. And so did it get worse from there? Immediately, that's when I made an appointment to see the doctor. I talked to my partner. I said, this doesn't seem right. Eleanor's not her usual self. She's not playing. I think we also had noticed some night wakings, nightmares sort of waking up, talking out of sorts, not knowing where she was, that sort of thing, but hadn't linked that to the drug. But that combined with the not having that play voice, and I think she had mood swings sort of up and down, but linking them all together made a clearer picture that it was probably associated with the drug rather than just one thing on their own.
Celeste, the TGA says it's got the information in the box, you mentioned it before, and it encourages doctors to speak through the side effects with the patients. Do you think that's enough?
No, I think you get that information and you read that information, and with all medications they've got side effects and some worse than others, but you never think it's going to be you, and you don't take it seriously. I think there needs to be more warning. This needs to be harder to get hold of. This is being given to children who don't yet know how to explain what they're feeling. And it just needs to be harder to get hold of. It's a last resort.
Celeste, we really appreciate your time. Thank you.
Thank you.